There's two main reasons why women will have difficulty with loss of urine. It helps to think about the bladder and its anatomy in order to understand what those are. If you look at my hand, this is a diagram of the bladder. This is the exit tube, or the urethra of the bladder, and this is the big balloon that fills up with urine, and when it's time to go, squeezes the urine out. Stress incontinence, which is the first main type of urinary loss, has to do with the exit tube. This exit tube is unable to squeeze tight, so it can't hold on when you put any stress against it, like coughing, sneezing, laughing. That little tube's trying to hold on, but it just can't squeeze tight. The second main type of incontinence is urge incontinence. It has to do with this big balloon, the bladder, that's filling up with urine. This balloon is actually a muscle, and when it starts to fill up, that muscle has a spasm and says, I need to go, I want to go, I'm going, even though you're yelling at it and telling it it should wait for a more socially appropriate moment. The treatments can be very different for one versus the other, and unfortunately some women can have both stress incontinence, weakness of the exit tube, and urge incontinence, or spasms of this muscle. Certain things predispose women to developing urinary incontinence. Pregnancy and childbirth stretch the bladder and the urethra and the ligaments that support it. Heavy lifting, pressure against the bladder, excess weight that bears down against those ligaments. The genetics, the strength of the ligaments and support structures that we inherit, and unfortunately previous pelvic surgery, hysterectomy or surgery around the bladder or the urethra, can weaken the support structures.